Hello everyone, welcome to our YouTube channel. This is Nikki from Team Gyan. So today in this video, I would be discussing with you about the next entrance exam, which is scheduled to happen next year, which is 2022. But whatever I would be discussing with you is completely based upon the proposal because we still don't have the final verdict with us. We all know that because of the COVID, the final draft has not taken place. The meetings which are scheduled to happen has not happened. So the complete point of making this video is because we have been receiving a lot of queries from our students who are currently in their 4th year or students who have gone into the internship. Actually, these students are very much confused as to whether they would be sitting in for their NEET PG entrance exam or they would be sitting for their next entrance exam. So here we are to give you a brief intro about the next entrance exam. So first and foremost, what is next? So next is basically an exam which is known as the National Exit Test, which would happen next year. It is going to be a single window exam because this exam will scrap your NEET PG entrance exam as well as your MCI screening test, which happens for the students who have done their MBBS from abroad. Now, why this exam has become very important or everybody is so much confused about the exam? The reason is very simple. Like for example, whatever score you get over here would act as a rank you will get for your NEET PG college in a branch. Number 2, this is the sole exam which would act as a MCI screening test. Number 3, this is the exam which will give you the license to practice post your MBBS. And lastly, this might be an exam which will do away with your final year MBBS exam. Now again, this is again a proposal state. This final, whether this would replace your final year exam or not is yet to be seen. So that's why this next exam is coming out to be a very high stake exam for everyone. So there's a lot of confusion revolving around the same, that there's going to be sudden so much of a change and still we don't have any final verdict as to what would happen. But what we personally think is that if they have said that the next would happen in 2022, so be prepared that next will happen, because this year also they have suddenly changed the pattern for your NEET PG exam. In 2020, the proposed pattern was 300 MCQs for 3.5 hours. But this year they have changed the pattern to 200 MCQs, but the time was same as 3.5 hours. So be prepared for any last minute changes. So it's always better to prepare well beforehand than to last minute just think about what would happen or what would not happen. So coming to the second question, what is the next pattern? So next is basically divided into 2 phases, next phase 1 and next phase 2. So next paper 1 is basically the exam which would happen after your final year but before your internship. This would be the exam which would give you a ranking. So the scores which you get over here would be used as a score for getting your PG seat in the medical college or in the DNB hospital. So always remember that the next one paper would constitute an important factor in terms of getting a PG seat. Second, this becomes an important aspect because if you fail in the exam, you will not go for the internship. You will have to wait for the whole complete year to appear for the exam again, and then you can enter the internship phase. So never ever it has happened that you were stopped for entering internship before next. So next would also constitute an exam. It would also check into whether you would be eligible for your internship or not. Now coming to the next paper 2. Next paper 2 would be your practical exam. It is completely your pass and fail. It would not take into consideration the score. Whatever score you get is completely pass or fail in your next paper 2. This would not add to your next paper 1. Next paper 1 score is completely for your PG entrance exam, but next paper 2 pass or fail will give you the license to practice in India for both Indian students also as well as students who have studied their MBBS from abroad. Now coming to the paper pattern. The proposed pattern for the next exam is completely different from what it has been there from the previous year for the NEET PG. Right now, for the year 2021, the proposed pattern is 200 MCQs and the time limit is, and the time given is 3 hours 30 minutes in one sitting. But next paper 1 brings in with itself a lot of changes. Student will have to sit for back-to-back 3 days. There would be a pre-lunch and then there would be a post-lunch. In total, you will be sitting for an exam for 14 and a half hours and there would be 540 MCQs. So the paper would be divided into medicine and allied for the pre-lunch, surgery plus allied, obs and gynae plus allied. Over here, allied subject means dermatology, psychiatry, radiology, anesthesia. These would constitute your allied subject. Now, the post-lunch would be your pediatrics, your ophthalmology, your ENT. Your pre-lunch paper would be of 3 hours and there would be 120 questions. Your post-lunch would be 60 questions and 1.5 hour paper. Also, apart from this, there would be 10% of the question would be from your basic sciences. What does basic sciences means? Basic sciences means your first year and second year subjects like anatomy, biochemistry, physiology, pathology, pharmacology. These constitute your basic sciences. And lastly, there would be a 10% questions from your community medicine. Now, there is a lot of question that, okay, if only 10% of weightage is given to the basic sciences, so that means the first year and second year subjects are not at all important. See, always understand, from the year 2020, we have seen that there is a movement, there is a good shift in the way the questions is being asked. Now, there is so much of clinical questions which are asked. The questions are integrated. That is, if you are talking about medicine, you need to know about the pathology and pharmacology and physiology section. You cannot answer medicine without these subjects. So if I talk about the integrated, 2021 only showed that there is so much of a weightage given to the integration of the question, both horizontal as well as vertical. So basic sciences becomes very important. You cannot go in with your clinical questions without understanding the basic structure of your first year and second year. So again, it's very important. Don't take it very lightly because there would be integrated questions coming up. Also, if you look into the way they have proposed the pattern for the pattern for asking the question, 60% of the questions would be problem solving. 30% is given to comprehension and analysis, and 10% is given to recall. That is, direct questions would be only 10%. That means integration of your subjects has become one of the most important concept over here. Apart from that, the next paper 1 would be a complete MCQ based question. It would be computer based and it would be conducted across India by a central body. So now if I make it very simple, it's same as the plus 2 boards. There are CBSE schools across India, but there is a CBSE board which sets a paper for everyone. So it brings a uniformity in terms of the question paper, the way they check the paper, etc., etc. Similarly, next is going to bring a lot of uniformity. So whether the college is a government, private, deemed peripheral college, they would bring a uniformity in the type of questions they would be asking, in the pattern of the exam. So passing next paper 1 becomes very important. If you don't pass your next paper 1, apart from losing a PG seat, you are also not allowed to enter the internship phase. Like for example, if you don't pass your final year, you don't go in for your internship. Similarly, if you don't pass your next paper 1, you will not be eligible to sit for the internship. Now, what does it bring again is you have to wait for complete 1 year to give next paper 1 again. And then you can enter your internship phase. After you have completed your internship, you have to sit for next paper 2, which would be a practical exam, which would be conducted by your university or the college. So this is going to be just a pass or fail exam, the next paper 2. It will give you the license to practice after your MBBS. And people who don't pass this exam cannot practice, and people who don't pass will not be able to go for their PG courses also. Because to get into the PG, passing in both the papers is mandatory. So these are the small things which you need to understand before you take a step forward. Apart from that, coming to the next question, what a lot of students are having, whether they would be sitting for, especially the students in the 4th year right now, or the students who have entered internship, whether they would be sitting for the next or they would be giving your NEET PG. If I talk about students of 2016 batch, students who have just entered the internship, things are not very clear for you. It could be again a NEET PG paper, or they can come up with the next exam. Although you have completed your internship, there would be things which would be clarified by the NMC themselves. So our suggestion is, please go in with detail of your subject. Don't neglect anything. Go in with your clinical experience, clinical classes. Study with your very basic concepts. Students who are in their final exam, they would definitely be sitting for the next exam. Now, there's one more important factor. See, always understand the 19 subjects are still the same. Only the change which has come up is the change in the pattern for the exam. Also understand one more factor. If it has changed for you, ये सबके लिए चेंज हुआ है. ऐसा नहीं है कि सिर्फ एक ही बच्चे के लिए चेंज हुआ है. Everybody would be on the same boat at the end of the day. Only people who are very much consistent with the preparation, people who are solving their MCQs, people who are doing the in-depth studies will be able to sail in the exam. It is just not on the basis of why I'm telling you because of the next exam. This applies true today also in terms of your NEET PG papers also. NEET PG exams also. Like for example, if you look into this year's pattern, there are 200 MCQ and the time is 3 hours 30 minutes. Last year there were 300 questions and the time was again 3 hours 30 minutes. That means they have reduced the number of questions by 100. So simply this means that they are giving maximum number of time for solving the less number of questions. That means they are going to increase the clinical weightage questions. So guys, please focus on your studies. Stop getting carried away with the rumors whether you will be sitting for NEET PG or next exam. Our suggestion is just be thorough with your studies. Get in-depth knowledge in terms of all your subjects, be it your medicine, surgery, your anatomy, biochemistry, physiology, because all the subjects are interrelated. If today they are going to ask you any question, that would be integrated questions. So you need to have a basic subject knowledge. So there would not be a point where suddenly the NMC comes and at last moment December they say that you are going to sit for your next exam, and there would be certain tweaking over there. So it's better that we prepare beforehand and rather than getting panicked at the last moment in time. Hopefully this video helps you to a certain extent. Apart from that, if you have any doubt, any query, you can directly reach us, and you can also follow us on Instagram, Twitter and Facebook link, which is just provided in the description box. Thank you.